Simulation is something that's really helpful for our students. It allows the students to get clinical experience in a safe environment.
It's important to have a simulation center such as this to create acute care scenarios for students that don't often happen in the hospital situation, because it's our job to graduate safe, competent practitioners.
We can bring up and put them into those clinical situations, allow them to practice and do whatever it is that we want them to do, and they're doing it in an area where I don't have to worry about whether or not they make a mistake. If they make a mistake, the worst that happens is say, hang on, let's reboot the computer and we'll go again at that.
Moving here, and I'm sure that the other faculty were looking forward to that too, having the high-fidelity mannequins where you can really develop a story and make it happen through the simulation and make that mannequin come alive and respond to changes in blood pressure, changes in heart rate, and see how the students will react to that.
I had students who they were running a code and the decision was made to stop the code. The patient was going to die. It was built into the scenario. And some of the students got upset about it. We had a couple started crying. So it tells you kind of how realistic it is. I have a room that is either set up, can be either an OB room or an OR room. So it functions, truly looks like and functions as an OB room or an OR room. So it actually will allow me to have clinical areas that I want.
It's important for us to look at, okay, I didn't have enough time in my classroom to cover that material in lecture or to have scenarios, case studies in my classroom, but then I can create that particular topic in my simulation. We do have one instructor here that will do some of her lecture and some of her teaching case scenarios, and just 10 minutes after she talks about it, she goes straight to the simulation for the realism of it and to drive home points. There the simulation takes place, and that learning is invaluable.
We put them through the scenario, and we have some ways that we can measure, well, I think that the student got that concept, I think they got this concept. And then later at the debriefing stage, we'll say, so tell me about that situation. What did you learn?
The students love simulation. So we're trying to incorporate it in as many of our courses as we can for that reason, because they learn so much. It helps them to critically reason. It helps us with our course outcomes. It helps us with our end of program outcomes to meet those.
We have had many inquiries about using our simulation lab. We, of course, use it with our staff over here at St. John's, but the other hospitals in our system have inquired about using it to help improve their skills. And we've had other agencies reach out to see if they can use this for their residents. We're really excited about just having this state-of-the-art facility.
Anyone who can benefit from this area, it's open to anyone. Even high school students could use it for health promotion. Any of the other colleges of nursing that are totally welcome.